Dear colleague, in this case we want to talk with you about the case of rhabdomyoma. The rhabdomyoma is the most common tumors of infancy. Is a congenital cardiac tumors. The congenital cardiac tumors is rare. The occurrence rate in infant is approximately in 0.024%. The rhabdomyoma is diagnosed in the fetus at early 21-week gestation. The rhabdomyomas tend to be multiple in 90% of cases and occurring most frequently within the right or left ventricular, sometimes within the interventricular septum. Most congenital cardiac tumors like this are isolated anomalies, but tuberous sclerosis in rhabdomyoma has been reported in 50 to 19 about of patients diagnosed with rhabdomyoma. It's correct to remember that the tuberous sclerosis is a multisystem disease characterized by the triad of adenomas bacterium, epilepsy, and mental retardation. The tuberous sclerosis is a familial disease inherited as an autosomal dominant trait. Rarely, the tuberous sclerosis, it may be a sporadic event. The cardiac finding in fetus with rhabdomyomas is related to the presence of echogenic nucleus multiple for the number, size, and position of these tumors. And we have in the heart the presence of these echogenic tumors that sometimes is really similar to finding of single golf ball. Then the difference with golf ball or echogenic nucleus single are the presence of many of these tumors. The presence of multiple tumors is then indicative of rhabdomyoma. Ultrasonographically, they appear as hyperechoic, heterogeneous masses in variable size. They are unencapsulated lesions. Areas of fibrosis or calcification have been identified within them. Rhabdomyomas sometimes simulate hypoplastic left heart syndrome. But you have to see in this image that there is no smaller ventriculars, but large tumors inside it. Then we want to tell that the presence of intracardiac masses and the presence of many of these tumors are statistically suggest for rhabdomyoma. Conservative management may be undertaken for asymptomatic patients because when there are, like in this case, just this finding of 4 or 5 of these tumors, we have just to control the regular anatomy for the heart. But it is important to say that the tumors causing significant hemodynamic compromise. The spore obstruction caused from these tumors because they invading the myocardium and causes dysrhythmia. Then when we found these tumors, we have make an accuracy check for the anatomy of the fetus. In this case, we have make a control for the brain, we make a control for the kidney, because we have to be sure that there are no other problem. No problem because we have to be sure that there is no situation about this arrhythmia. We have to make a genetic counseling for these patients, cardiac control, several cardiac control during the pregnancy, and then we have to say to patients the possibility that this kind of tumors will be spontaneous regression. Thank you.